Bismillah ar-Rahman ar-Rahim.
All right, there we are. Hey, Omar.
Good afternoon, Ashley. How are you doing today?
I'm all right. How about yourself?
I'm doing great. Thank you for asking.
Good. Glad to hear it. How's your week been? Or how's
So I'm
been all the way
upset.
up until this week?
I'm upset because my mother's not feeling well all of a sudden. Literally,
Okay.
I had a conversation with Janicia Tyler, who's the case manager for my newborn daughter, my youngest daughter, Jamila, and she's
Mm-hmm.
she's in at ChildNet, some kind of adoption place, and we're trying to bring her to my mom's house, so she's not in some uh, adoption
Like
agency
foster system or okay.
and
Adoption agency, okay.
or foster system, whatever it's called. But the I told her that I'm gonna call her uh, as soon as I get back from my dermatologist appointment. And I had a dermatologist appointment yesterday. It was the day before yesterday. And they sent an unsanitary transportation vehicle that smelled like methamphetamine. And literally, as soon as I opened the door and was about to enter the vehicle, the smell just made me
Mm-hmm.
nauseous and sick and dizzy. So I immediately walked away from the vehicle, walked back into the dermatologist's office, called the Humana Medicaid Motive Care government health insurance transportation again to tell them to send another driver. I told them the vehicle smelled like methamphetamine and I need them to send another driver right away. They sent another driver. I called the Leon County Sheriff's Office, the 911 non emergency number, told them that vehicle smelled like methamphetamine, told them the license plate number, gave them a description of the vehicle and a description of the driver. Another vehicle arrived shortly after, and then by the time I got home, I was trying to hurry up and clean myself and change my clothes, and then call the case manager for my daughter Jamila because she asked me
Mm-hmm.
to call her and call my mom so we could have a conference call so we could uh, arrange my daughter going to my mom's house. And by the time I got home and was able to hurry up and get dressed and clean myself and change my clothes, it was 6 o'clock. And I tried to call her on three-way with my mom on the phone. She didn't answer. I called her a few times. I left two voicemails or three voicemails, and I sent her an email and a text message. And then uh, she replied. I think it was the next morning. She replied and said um, to call her before 6 p.m. And so so the next day I called my mom around the time she usually gets home from the school that she teaches at, and she told me she wasn't feeling well all of a sudden, and
Uh-huh.
she said she was like she wasn't feeling well, and um, she went home early, I think, from school, and it's really pissing me off because there's a pattern that's forming, and it's literally like a spoofing scam intertwined with my phone being unethically hacked and people maliciously harassing me and my family and malicious and an overwhelming amount of malicious obstruction of justice, all out of a desperate defense for my opposing counsel so they don't get in trouble for me reporting the fact that they injured me and then lied during, before, and after every complaint that I made, during, before, and after every uh, necessary legal and medical obligation I tried my best to fulfill so I could uh, fully recover from my injuries and obtain monetary relief from my opposing counsels and the responsible parties who are supposed to pay me because they injured me. And my mom told me literally the next day when she got to school, she started feeling sick out of nowhere,
Uh-huh.
and I feel like somebody set her up, and I noticed also, when I'm talking to the people at the Child Net, or I'm talking to talking to people at Humana Medicaid and different doctors that I'm specialists that they're telling me I could go to, and it's very difficult for me to get referrals from the primary care physician to send them to their specialists, and then they'll tell me they sent it, and then I call them, they tell me they didn't receive it, and it's just, it's obvious to me that they're my enemies, and they're acting like they could get away with maliciously harassing me, and the pattern that's forming is proving exactly that. And it might not sound like a big deal to some people, but to the person who it's happening to day in and day out, and I'm witnessing it in real time, and I'm witnessing the severity and the amount of obstruction of justice that my opposing counsels and their friends are involved in, all out of a desperate defense so they don't get in trouble. It makes me honestly feel like if I don't stop them, they're going to end up killing me or my family members out of retaliation. And just by them telling me something like, call me before 6 p.m. And then literally the next day when my mom goes to school, she gets sick out of nowhere. And she catches the coronavirus. And now she's at home, she's taking antibiotics, she's not feeling well. And then, literally while I'm calling her to check on her, right? Listen to this recording. Oh, I can't even turn the recording on because I'm documenting this. I'll email it to you. But literally, when I called my mom to check on her, and she was telling me she's not feeling well, and the doctor gave her antibiotics, and it sounded like she was in pain, and she was upset and crying and not feeling well. I got a phone call while I was on the phone with her from somebody who's supposedly the clinical administrator at Neighborhood Medical Center. They told me she was a supervisor. And when she called me while I was on the phone with my mom. I answered the other line, and she said, "This is Jamila from Neighborhood Medical Center." But she was like making her voice sound real like childish. She was like, "Hi, this is Jamila from Neighborhood Medical Center." Like, you know what I mean? Like, my
Like
daughter.
it was a fake child's voice?
Yeah, and then not just that, but my daughter's name is Jamila. And I was literally just on the phone with my mom on the other line, and she was not feeling well. And the day before that, I got an email from the case manager, Janicia Tyler, who told me to call her before 6 p.m. in reference to a conference call for my daughter Jamila so she could go to my mom's house. And then when she called me, she told me that a nurse at the neighborhood medical center told me I called them and asked them for a referral for an ENT doctor, an ear, nose, and throat doctor, because I have a nasal infection, my ears are clogging up, my throat's clogging up, and it's all because of the gum disease that I have that I need perio maintenance to get rid of. And I was explaining to them that I have a dental appointment at Neighborhood Medical Center on April 20th, 4/20, 2026. And I've been telling them that I need to go sooner because they told me that I have gum disease and they can get rid of it with perio maintenance. And if I have to wait until April 20th, 2026 just to see the dentist, the gum disease is obviously going to spread to other areas of my body, which it already has. And they've already put in a referral for me to go to a gastroenterologist because the gum disease, obviously, the infection spread to my stomach. And I'm noticing that when I brush and floss my teeth, for example, after I eat something, I brush my teeth, and then when I floss, I notice when the saliva or the mucus or whatever gets on areas around my mouth when I'm flossing, I'll break out in those areas. There'll be little pimples there. And then I notice when I blow my nose, if the mucus gets onto the sides of my nose or onto my cheeks, I'll break out there, and then there'll be like a mark there where the skin's like inflamed and swollen from like a mark left from where the mucus touched my nose when I blew my nose. So I know that I have a nasal infection, and it's obviously all coming from the gum disease. And so I was explaining to them that I need a referral to go to an ear, nose, and throat doctor. And they were telling me also to call on Mondays and Fridays after 12 to see if anybody canceled their dental appointment, so I could go to see the dentist sooner, because they said on April 20th, 2026, that dental appointment is for a full mouth x-ray, not for perio maintenance. So if I have to wait until April 20th, 2026 to see the dentist just to do a full mouth x-ray, it's going to take longer for me to do the period maintenance, because they're not going to start doing the period maintenance that day. They're going to do a full mouth x-ray, then they're going to reschedule me again for another dental appointment to do period maintenance. And period maintenance it's just pretty much a teeth cleaning. But they clean the gums and all that other stuff. And I was explaining to them what they already knew. And I told them I need an appointment to see the ear, nose, and throat doctor because of the nasal infection and my ears feeling clogged up, my throat feeling clogged up. And they said, well, did you explain all this stuff to Jessica Leah, APRN, the nurse practitioner, your primary care physician, when you saw her a couple weeks ago or a few weeks ago? I said, yeah, I explained all that to her. I explained to her my injuries and my neck and my back, and my hands and arms going numb, my legs and my feet going numb, and that I need to go to the specialist because of my neck and back injuries. I need to go to the dermatologist. I need to go to ear, nose, and throat doctor. I need a nutritionist. I need to go to the eye doctor. I need to go to the gastroenterologist. I explained everything to her. She sat there for about an hour and listened to exactly how I got injured, and then all the problems that happened after that, and all the specialists I still need to go to. And she said she's going to put in the referrals for me to go to those specialists. And then, so when the clinical administrator got on the phone, she was asking me if she put in those referrals and if I explained that to her. I said, yeah, I explained all that to her. And she said, oh, I can see in your file that she put in a lot of referrals for you. So that's good. And I see she put in a referral for a pain management and dermatologist and gastroenterologist and all this stuff. I said, yeah, but I need to go to an ear, nose, and throat doctor also. And then she was saying, well, they want you to see Dr. Herkel at the 438 Brevard Street location, the other location that we have for Neighborhood Medical Center. And they keep trying to convince me several different ways and use several different people on the phone when I call to try to convince me that I need to go and see that doctor for pain management at that location. And I explained to them every single time I had a bad experience at that location. They couldn't pay me to go back to that location. And in the beginning, that's what I told them when I called them. And they said, okay, no problem. We have a primary care physician here at the 2613 Monroe Street location, Neighborhood Medical Center. And you could see Jessica Leah. She could be your primary care physician. She's a nurse practitioner. I said, okay, great, perfect. After I saw her, she put in some referrals for me. And then all of a sudden, they're telling me I need to go see Dr. Herkel because he's a pain management doctor. And then I explained to them I had a bad experience at that location where you guys are telling me he's at. And then when I spoke to the clinical administrator, she's telling me he's not even a pain management doctor. He's a primary care physician. He's an MD. And they want me to see him as my primary care physician. And I said, no, I'm not doing that. And especially if you guys are expecting me to have to go back to that same location where I had a bad experience multiple times, no, thank you. I'm not doing that. And they said, well, I see you had Charlie Richardson as your primary care physician at that location previously. And when I first moved to Tallahassee, they sent me to that location. And they assigned me Charlie Richardson as my primary care physician. But I had a bad experience there. He's a good doctor. He's very nice and humble and respectful. He's an elderly guy. But I got sick when I went there. So I never went back. I had a bad experience there, and I complained about the fact that I got sick when I went there. I changed my primary care physician. I even almost changed my health insurance. But anyways, and also another thing too, that doctor's office is attached to a graveyard here in Tallahassee. And
oh gosh,
that amongst other things, it's just. And then I got sick when I went there. It was really bad. And then, and they keep trying to make me go back there. And I know it's because I complained And then literally, that was one of the first primary care physicians I had when I moved to Tallahassee, and I immediately complained because I got sick. And then I had to change my primary care physician again, and I noticed they kept doing things to make me sick every time I changed my primary care physician. It's like if they were like picking on me for complaining. And and then, I documented everything step by step, every effort, every complaint, every single contributing factor, because I'm knowledgeable about these types of tactics that they use against people who are vulnerable and in need and who are victims with not many resources. And I know the only thing that could really protect myself and my family is to continue documenting all of my efforts and all of my complaints and every contributing factor to that. So I could finally be able to obtain monetary relief and not have to depend on them maliciously obstructing justice and acting like they're helping me, but they're not. And when I was speaking to the clinical administrator who identified herself as Jamila, I asked her, I said, well, you're acknowledging all these things and you're acknowledging that, the ear, nose, and throat problem is obviously happening because of my gum disease, and you're telling me to just keep calling Mondays and Fridays. Phone says reconnecting to call.
Okay, there we are.
And what I was saying was, while I was talking to the clinical administrator, who's supposedly identified as Jamila,
Mm-hmm.
she was saying, well, the ear, nose, and throat problem is probably more than likely coming from the gum disease. So just keep calling on Mondays and Fridays after 12 to see if somebody cancels so you can go to your dental appointment sooner. I said, yeah, well, I've been trying to do that. And I called today after 12 and they told me to call on Monday after 12 to see if anybody canceled so I could go sooner. So I wasn't able to reschedule an appointment because somebody canceled today. And she told me to call on Monday at 12. So I called Monday at 12 and then she was telling me, and I asked her, I said, so, and also in other words, so if you're telling me to go to Dr. Herkel at the 438 Brevard Street, Tallahassee, Florida location at the neighborhood medical center there to see him as my primary care physician, I don't have a primary care physician anymore. Jessica Leah, APRN at 2613 Monroe Street, Tallahassee, Florida, isn't my primary care physician anymore all of a sudden. And she said, no, she has a different assignment now at this location. And I was like, well, what? Well, since you guys just changed my primary care physician without telling me, could you guys, what was the word I used? Could you consider or I forgot what the word was that I used, but I said, could you guys, I pretty much asked her, could you see if there's any other primary care physicians that I could see at that same location where I saw Jessica Leah, or if I could see Dr. Herkel at that same location, that'd help. And she said, no, he's at that other location. He doesn't go to the location where Jessica Leah is. Okay, is there another primary care physician that I could see at that same location where I saw Jessica Leah, APRN, the nurse practitioner, who you said was my primary care physician? And I sat down for an hour with her and explained to her all of my symptoms and injuries and how I got injured and everything and all the specialists I need to go to. And she sent referrals for me to several specialists. And she said, yeah, well, there's several other primary care physicians here, but they're all fully booked and they don't have any appointments until 2026. I said, oh, well, I guess I'll be waiting until 2026. And in the meantime, if I need to go to any referrals, you guys could just send them to the specialist, because I already told Jessica Leah all of my symptoms and how I'm injured and why I'm injured and all the specialists I need to go to. So she's already fully aware of my situation and the specialists I need to go to.
And it's more so like you don't want to have to repeat all of that again, right?
What's the point of having to? That'll be a waste of policy. Right. That'll be a waste of policy. That's like, for example...
Well, wouldn't that transfer over anyway?
What do you mean?
Like, if she documented everything, if they transfer you to a different primary, wouldn't they have all that information?
Of course.
Shouldn't they have all that information? So
they obviously, yeah, of course. But, they're going to say, well, Omar, what's going on with you? Talk to me. What happened? And how'd you get injured? They do the same thing every time. It's like they just want me to explain to them the same thing I've already explained to literally almost every doctor in the same network of doctors that they're in Tallahassee. Literally in the same demographic area. And not just that, but they're all within the same practice. It's only a handful of them here in Tallahassee. It's the HCA Healthcare Administration network of doctors, the practice that they have, the Tallahassee Memorial Hospital network of doctors and the practice that they have, and then there's I think another one that involves like the Tallahassee Orthopedic Center and the Tallahassee Diagnostic Imaging Center and that network of doctors in practice. So it's only a handful of them. And I literally scheduled an appointment at all of them, and they discharged me from all of them. Literally, they tell me things like, oh, Omar can't go back to this primary care physician's office or this practice because we discharged him from this practice. And I asked them, I said, why'd you discharge me? They told me things like, oh, we can't tell you. Then another primary care physician's office, they'll tell me they discharged me from the practice. I ask them why they discharged me. They tell me things like, we don't know. And for example, another location, the Tallahassee Orthopedic Center, where I had a pain management doctor there. And I called them on three-way, it was yesterday, with access to care representative. She's some kind of supervisor at access to care department at Humana Medicaid. She called me yesterday because I filed a grievance because I'm having difficulties finding a specialist to go to, a pain management doctor here in Tallahassee, Florida. And the only doctors I was able to find are approximately 100-mile round trip from my house here. And it's difficult for me to travel long distances in a vehicle because of my neck and back injuries and the pain increasing and my hands and arms and legs and feet going numb. And I filed a grievance. She called me yesterday, and then she asked me to call several pain management doctors here. I mean, on the list of doctors that they had from Humana. And I told her they told me they discharged me from the practice. I can't go back to those locations. So I called them on three with her on the phone, and the one at Tallahassee Orthopedic Center, they put some kind of supervisor on the phone. She identified herself as Miss Valerie, and she said, "Oh, we discharged Omar from this practice." And I said, "Why?" And she said, "Because he missed his appointment." I said, "Well, I'm injured." And I only had one appointment, and that was with pain management Dr. Jonathan Chiwalayu, and I only saw him once, and he ordered x-rays of my left ring finger that the officer broke, and x-rays of my neck and my back that the other officers injured. And he said he was going to put together a treatment plan for me. And then after I saw him that day and did the x-rays, and he said he was going to do a treatment plan for me, I got a phone call from Tallahassee Orthopedic Center, and they told me I need to find a new pain management doctor because they discharged me from the practice. And I asked them why, and they said they didn't know. Then when I spoke to them on three-way with the access to care department supervisor, it says because I missed my appointment. And that's not true. And then when I called the pain management doctor that Jessica Leah sent the referral to, Dr. Thomas Fronifer, and I scheduled an appointment to see the doctor, and then they told me they canceled my appointment. And I called them on three-way with the access to care department supervisor on the phone from Humana Medicaid. And I said, my primary care physician sent a referral for me to go there for pain management. I'm calling to confirm my appointment. And they said, no, we had to cancel your appointment because we haven't been reimbursed for the two other Humana Medicaid patients that we helped. And until we get reimbursed for those two Humana Medicaid patients, we're not accepting any more Humana Medicaid patients, and we had to cancel your appointment. And then the access to care department supervisor said, well, you guys are in contract with Humana Medicaid. You can't just cancel patients' appointments out of spite because you haven't been reimbursed for other patients. Which makes sense.
Which is true, right? Because that doesn't make any sense that they basically are penalizing whoever has Humana,
right?
Because they haven't been reimbursed.
Right. And then what else? Then we called another place, and they said, and then we tried to get smart about it. I said, okay, you know what? Let's not schedule an appointment with pain management, which is what several specialists already told me I need pain management because if I'm not going to do surgery to fix the pain, then the only other thing to help me is going to a pain management doctor. Going to the chiropractor, going to the emergency rooms, that's not helping. That's just reassuring that I'm injured and I'm in pain and I obviously need help. And if I'm not going to do surgery, then a pain management doctor is the only thing that could help me. And I've been having difficulties obtaining a pain management doctor and a treatment plan, despite the fact that they did x-rays at several pain management doctors, locations. Tallahassee Diagnostic Imaging, and then the place literally right next door to Tallahassee Diagnostic Imaging. After they did x-rays there, they did x-rays also at the Tallahassee Orthopedic Center, which is right next door. And also at several other locations here in Tallahassee, including emergency rooms. And so we got smart about it, and we said, okay, let's schedule an appointment with the chiropractor. So I found a chiropractor on list of doctors who are within the network of Humana Medicaid. I called them on three-way with the Access to Care manager from Humana Medicaid on the phone and I scheduled an appointment, and they're approximately 45 miles from my house, so it'll be approximately 90 to 100 mile round trip. But I scheduled the appointment with them for October 6th, 2025 at 2:20 p.m. Central Time. And then after I scheduled an appointment with them, I got a phone call from a chiropractor here in Tallahassee, and I asked them, and they said they accept Humana Medicaid. So I scheduled an appointment with them. They said their soonest appointment is literally the same day that the other chiropractor that was approximately a 90-mile round trip away from me said they have an appointment. They said they could schedule me on to see the chiropractor on October 6, 2025 at 3:30 p.m. I said, okay, great. And then, I had an appointment scheduled with another chiropractor here in Tallahassee named Dr. Andrew Lewis. I scheduled an appointment with him, and then literally the same day of my appointment, which was yesterday, or was it yesterday? Yeah, I think this all happened yesterday. I spoke to him early in the morning. He called me and he said he had a personal matter, like an emergency, where they had to reschedule my appointment, and he wasn't going to be able to see me at my appointment at the time that I scheduled it, which was, I think was 3:30 yesterday. And he said his office is going to call me to reschedule the appointment. And then I was explaining to him everything I explained to you about how they discharged me from all those other practices here in Tallahassee, and they just kept telling me excuses about why they discharged me, and then some of them would tell me they don't even know why they discharged me. And then he told me, he said, well, I'm not going to be able to reschedule my appointment, the appointment here, until I receive the documentation of why they discharged you from those practices. And I explained to him what they told me.
So is that the real reason? Is that the real reason why he canceled then? Because he didn't have that documentation?
Well, I asked him. I said, so, and he told me that after. He said his office is going to call me to reschedule my appointment. And I asked him when. And he said, probably next week. And then I was explaining to him the severity of the situation and how serious my injuries are. And then he was telling me He said, "Well, there's other places in Tallahassee you could go to for to see a chiropractor or pain management. There's a lot of doctors here." And I said, "Yeah." And I went there and I spoke to them. And they said they discharged me from their practice. And he said, "Why?" And I said, "Some of them told me they didn't know. Some of them told me they can't tell me. Some of them told me because I missed my appointment." And then, I know the one that told me I missed my appointment, I didn't know that until later on that same day when I spoke to them on three-way with the Access to Care
Mhm.
department supervisor. But I told him that they told me they didn't know, and some of them told me they couldn't tell me. And he said, "Well, I'm not going to be able to schedule your appointment now until you send me that documentation stating why they discharged you from their practice." And I said, "So, in other words, I can't reschedule the appointment until I call them to ask them again why they discharged me?" He said, "No, I need the documentation stating why they discharged you." And I explained to him. I said, "I'm gonna be honest with you. You know, it's gonna make me really uncomfortable, and it's already traumatized me when I called them and tried to schedule the appointments, and they telling me things like they discharged me, and they won't tell me why. And then when I call to schedule appointments to see other specialists who are within that same practice, they tell me I can't even go to that practice because the doctors that discharged me from that practice, they're at that same practice. So I can't even go to that practice at all, which is the HCA Healthcare Administration network of doctors, the Tallahassee Memorial Hospital network of doctors, and the doctors at Tallahassee Orthopedic Center." And then he said have a good day, and he hung up the phone. And he said somebody's waiting for him, and he said have a good day, and he hung up the phone. And then um, that's when I tried to find another chiropractor to go to. I was looking on the list of chiropractors, and then that's when I called the other one that I found in Tallahassee, and I think they called me back while I was on the phone with the supervisor from the Access to Care department after I scheduled the appointment with the chiropractor that's approximately 90-mile round trip away from my house. And I scheduled the appointment the same day, and then I called the chiropractor that's approximately 90-mile round trip away from my house, told them what happened, canceled that appointment, and now I have an appointment with a chiropractor that's closer to my house here in Tallahassee on October 6th, 2025 at I think 3:30 p.m. or something like that. I have to look at the email again where I documented it. And then, but the when I go to the chiropractor, they're gonna tell me the same thing, that I need pain management, because I already went to chiropractors. I already went to get X-rays. I already went to emergency rooms. I already did all of those things that I need to do before they tell somebody, okay, you need to go to pain management or you need to get surgery. And I already went through all that. And when I go to the chiropractor, they already told me the chiropractor is just going to adjust your spine and uh, that's it. They just adjust people's spine. And I don't need a spine adjustment. And I told him that. I told him I have bulging discs in my neck and in my C3, 4, 5, up to C7, 8, 9, all the way up my spine. And I explained to them a doctor at Tallahassee Memorial Hospital, she did X-rays of my or CT scans of my spine, and she told me I have bulging discs, and that's why my hands and arms keep going numb. And she said the same thing. I need to go to pain management. And this was, I think, maybe 2 or 3 months ago when I saw her at the emergency room. She told me that. And I explained that to them on the phone with the chiropractor, and um, the after I hung up the phone with them, we called my primary care physician on three-way, and the access to care department supervisor told the referral coordinator, Dontavius, that I need a referral to pain management. And he said, "Oh, Jessica Leah put in a referral form to see Dr. Thomas Fronifer." And she said, "Yeah, but they said they're not accepting Humana Medicaid patients right now." And then I explained to him what they said, that they haven't been reimbursed for the other two Humana Medicaid patients, so they had to cancel my appointment, and they're not accepting any more Humana Medicaid patients until they get reimbursed for the other two Humana Medicaid patients that they helped. And Dontavius said, "Oh, I just got off the phone with them. I just talked to them." He said, "That's weird." And, it's like, and then, she told him how to put in a referral for me to go to a specialist that's not within the network of Tallahassee. Pretty much sending the referral to a different doctor that's not on the list of doctors on the Humana Medicaid website. So, like, for example, if I Google pain management doctors in Tallahassee, which I already did, it's almost 100 of them here. And more than, I think about half of them, they're not at the locations, or at the addresses at least, of the locations where they told me they discharged me from that practice. But a lot of them, they're in the same practice, not necessarily at the same address. But there are several that I could go to, and they won't tell me that I've been discharged from that practice. So she explained to him how to send a referral to an out-of-network doctor, because he asked her, he said, "Well, how do I do that? Because I this is all new to me. I've never done this before." And he told me he's not a medical professional and all this stuff. So it's now he's a referral coordinator at Neighborhood Medical Center, and I've been literally having to call him and stay on top of him sending the referrals to make sure he sends them and stuff like that. Now, and then when I called him with her on three-way, I said, "Hey, Dontavius, how are you doing today?" He said, "Hey, how are you doing?" I said, "Oh, I'm doing great." I said, "How are you doing today?" He said, "Omar." Like that,
Why you said your name like that?
Yeah, like if he was like trying to, what's the word? Be sassy or something.
Reprimand? Oh, I was gonna think like reprimand you or something.
Right.
That sounds like authoritative.
Right.
Why are you saying my name like that?
Right. Exactly. And I said, and I acted like I didn't hear him, and I said, "You said," I said, you said you're doing great." And then he started like choking up on his words. He was like, "Oh, yep, great, yep." And I said, "Oh, that's great." And then I started, and I told him, I said, "I have a representative on the phone from Access to Care, the Access to Care department, a Humana Medicaid. She says she's a supervisor. She's trying to make sure I'm able to go to a pain management doctor." And then that's when she was explaining to him about how to send a referral to an out-of-network pain management doctor. And then he was saying, "Oh, this is all new to me. I don't know I've never done this before. Could you tell me what I need to do and stuff?" So she was explaining to him to put in the specific codes and to how to send the referral to the out-of-network doctor so they could get paid and all that stuff. And pretty much, telling him to send a referral to an out-of-network doctor and to ask them to help me for a price that's much cheaper than they're used to helping patients for. And so he said okay, and and then when I got off the phone with them, I ended up having to file another grievance because of the an unsanitary transportation vehicle. An unsanitary transportation vehicle that picked me up from, what was it, the Publix pharmacy. And I filed a grievance because of that. And then also I filed another grievance. That was the other day when I filed that grievance. But I filed another grievance yesterday also because of the same thing, the same problem. I'm still having difficulties being able to go to the specialist that I need to go to here in Tallahassee. So I filed another grievance, and they specified on the grievance it's because of police brutality injuries and having difficulties going to specialists here in Tallahassee. And it's difficult for me to travel long distances because of the neck pain and back pain and my hands and arms and legs and feet going numb. And I need to go to several specialists. And she specified that in the grievance. I documented it. And then I sent the information of the grievance to several participating government agencies who are responsible for paying me. And I put them all in the same email thread, including several other people who are in my treatment plan. I put my family members on the same email and several participating government agencies, so everybody could be aware all at the same time. And I got an email today from the governor, Ron DeSantis, and the email was sent to me at the same time, same day, and attached to the same email as the risk management department adjuster from the city of Miami risk management department. And he said he'll be out of the office until July 7th, 2025. And he'll, I think he said he'll get in contact with me and address my concern when he returns. And he said, if this is urgent, please call 305-416-1700. And so I emailed him, and I said, I've called that number several times, and I've left several voicemails, and I've sent several emails to the City of Miami Risk Management Department, and they still haven't paid me. How would you like to proceed? Through mediation and an out-of-court settlement, or trial? And then I wrote, this is an urgent matter. And then I called the 305-416-1700 number, a woman who identified herself as Raquel, who works there, Raquel or something, she said. I explained to her what happened. I explained to her, first I said I received an email from the City of Miami Risk Management Department, and they told me to call this number because it's an urgent matter. And then she said, who did the email come from? And I said, someone identified as Prosper Sylvain. She said, okay, that's your adjuster. And then I explained to her everything that I've ever explained to you about Officer Ronnie Rodriguez, badge number 42511, putting me in a chokehold, twisting my neck to the right, body slamming me on my left side, and all those things. And then literally, but in detail, how I explained it to you. And then she said, and I said, do you need me to send you that in writing? And she said, no, it's already in your file with the adjuster, and I'll tell him to contact you as soon as possible. And I said, and then on the on the email he sent me, he said he's out of the office until July 7th, 2025. And she said, "Oh no, that's a typo. I'm sorry, that's a typo. Uh, uh, but I'll make sure he contacts you as soon as possible." Because today is October 3rd, 2025. How is he
Right.
gonna contact me on July 7th, 2025? The month of July 2025 was a few months ago, approximately.
Right.
And then I called my father yesterday, and he was at the foot doctor because his right foot is swelled up, and his right foot is swollen because he was trying to take a shower, and he said he slipped in the shower, and his right foot is swelled up now. He's at the doctor's office. He was showing me his foot on FaceTime, his left foot that he just got surgery on, and it's still swollen also, and literally. My phone just died.